Um, well, Brandon, you are the Vice President of Innovation Development at UnitedHealth Group, but you are not a healthcare guy, right? I mean, they brought you in externally for that purpose. Talk about that and talk about the experience of kind of coming on board to innovate within one of the major healthcare payers in this country.
Okay. Yeah, about a little over 2 years ago, the company decided that we needed to do innovation a little differently, at least at the enterprise or the global level. My background's actually in innovation, but it's in retail, consumer products, and consulting and such. And and the way we look at things, often in those industries, is a little bit different. And the way we get into the minds and the hearts of the consumers and understand how to develop products and services for the future is a little different. And they thought, well, maybe that would be okay for a big healthcare company to get into that with the ongoing retailization or consumerization of health. And what does that mean? And I actually saw something the other day I'd like to share with you just to kind of break it down. And I also know this is after lunch and we're all heavily engaged in the sugar coma that happens as a result. So let's take it out of healthcare for just a second, and we'll pop you in the grocery store, right? You're standing in the grocery store in the line. There's a whole bunch of people in front of you, and you're pushing your cart through. One of the great operational innovations, if you can consider it that, in grocery stores was the express lane, right? 15 items or less. You can't have anything more. So by raise of hands, who's ever been in that great express lane, but the guy or gal in front of you has more than 15 items in the lane, and that gets you really frustrated, right? What's going on? And so we saw this picture that's up before you now, and this is either the downfall of humanity, if we have to make it that simple, or it's brilliant and genius. 15 is this many, and your next question is, well, I don't have 5 or 3 hands, so how can I possibly understand that? But bottom line is the ability to make things simple and usable and things for the consumer. All right, that slide can go away. And so what we try to do is to introduce the same tools and methods into a large healthcare insurer and all the other things that we do that you would in a big best-of-class CPG or retailer in terms of getting into the hearts and minds of your consumers, understanding them at a visceral level. It's not for the benefit of the system. It's not for the benefit of the provider. It's for the benefit of the end user here, which happens to be the, you can call them patient. We like to call them member, or the human. Hey, let's call them people. For use of a better word, and learned a lot of new acronyms from there. And so us and our team help to coordinate and develop new innovations kind of across the organization. In such a large company, you've got lots of different divisions, lots of different segments. There's plenty of new product development, great innovations that are going on within those business segments. And where we have a chance to connect those dots, we often have a chance for a good, new and interesting breakthrough opportunities.
So how did that, how did that culminate? Was there a first example of what you did at UnitedHealth Group? Was it you took them to CES, for example? Was that the first move toward taking some of these retail ideas and other ideas and applying them at UnitedHealth?
Yeah, well, so the CES thing is an interesting example, and that was just typically you walk into a new organization, you're doing the leadership walk around. I called it a health check for innovation. Developed a survey and all kinds of things with our leaders, and as a theme of what was coming out of those conversations, as I asked them, where do we want to be in the future, because that's where we want to aim our innovations towards, they said, we want to be at the confluence, or to use the word of the day, the convergence of health IT, consumer technologies, etc. And I said, wow, that sounds really interesting. Great. So what are we doing at CES, being the Consumer Electronics Show? Now, a big health insurer doesn't go to the Consumer Electronics Show. That seems a little out of sorts. And most of them said, well, what's CES? I don't understand why that's relevant and makes sense. But to their credit, they said, great, let's go and let's figure it out. And we went there, had a little double-wide booth the first year, which was 18 months ago, and half the reporters that came up basically did a double take and said, what are you doing here? It just doesn't make any sense for you guys. As a result of that first meeting, though, I had a number of things pop up that are now in my portfolio of things we manage that are moving forward in the organization, new innovations that we would never have had if we don't talk to voices outside of our own regular industry vertical. Fast forward a year, this last year we had, as per CES, if you've ever been there, which happens to be the largest trade show on earth, bar any, a very large booth space. We keynoted and did some things at the Digital Health Summit, which is really interesting for those of you in this room. The Digital Health Summit maximized and became, I believe, the largest summit at CES in only its second or third year. so that the hunger for digital health technologies and new innovations coming out of the space, you're seeing from all across different industries. And we like to call healthcare the everybody's adjacency. Strategically, right? Everybody wants to get into healthcare or a piece of it, and they just don't know exactly how. And by talking at the periphery of your industry, not typically in the core, but the innovations often come when you're bumping up against other industries and them coming in. I think CES is just one example of doing that, and then as a result, launching innovations and collaborative efforts with others that are hopefully going to bear fruit.
What are some of those periphery things that you talked about that are now in that pipeline, if you can talk about them? Are there any good examples of something that says, wow, this would have never happened if we don't step out of our sector and go and touch some others?
You know, one of the things, and it wasn't spearheaded by me, which is great, right? We have people in the organization who are then talking to others that they wouldn't have naturally been talking to. There's a business right now called the Diabetes Prevention and Control Alliance, and it was actually a culmination of a collaboration with a couple of industry partners and non-industry partners. So with retail, your CVS's, your Walgreens, your others, and then the YMCA, greater YMCA is getting them across the United States, and UnitedHealth Group as a benefit to understand. We understand what the markers of prediabetes are. We can tell from your claims history, if you're a member of ours, if you're getting in that direction. We can directly reach out to you, and we can get you involved in a program, much like Dr. Nash talked about before, that if you lose X% of your body weight or you get involved in these type of programs, it has a great likelihood of you not then flipping over and becoming diabetic. But it was only because we were able to actually step outside of our own thought process and who we were, and be able to collaborate with others who we don't typically collaborate with, that was an opportunity. And now it's been growing and it's rolling out through a number of states, and we have some high hopes.
And is obviously UnitedHealth has its own. A lot of this comes back to data, right? I mean, you're talking about reaching out, learning things, and leveraging the data you have. How will UnitedHealth? How do they look at the data they have, and how are you applying that in different strategies as United grows and changes?
So United, frankly, you can consider one of the crown jewels of the company. Has decades worth of longitudinal data, claims data, and otherwise across millions and millions and millions of lives. And we also have the good fortune of consulting around the world with health systems and have access to some of that data as well. If you believe some of our IT guys, they think we have the largest amount of health data in America. And so the question is, what do you do with all that? What can you do, and how do you make that actionable? And there's obviously plenty of laws and regulations around what you can and can't do, and the de-identification of that is a pretty important piece. But we use that data to work, for example, in our insurance business with employers to help them understand their populations and what is going to be happening with those populations based on the care that they're going to need based on the markers that they actually have. Frankly, we would be very interested and are interested. We have a lot of IT folks in our organization, but are always looking to partner with others who can bring solutions to us of digesting all of this, I don't even know what the word is anymore, amount of data into something that is usable and actionable at the individual level, or at the small group level, or at the employer level for the government, because it takes quite a long time to get that done. Some of those are regulatory hurdles, but a lot of it is just literally computing power and being able to make those things happen. We have guys that are in that, but that we're always open to working with others and collaborating with them if they believe they have solutions that would be good, especially as we push into ACOs and population health.
So so the way that you're partnering, you're looking to partner, it's around people who can interpret these gobs and gobs of data so that a patient or a customer doesn't have information overload. Is that a good example? Or are there good examples of sectors that are exciting you personally, or UnitedHealth as an organization, that are meeting unmet needs?
That would be part of it. Part of it is, so it's literally just digesting all the information, being able to come up with something. Part of it is, we don't assume we even know all the right questions to ask of the data. Great smart people in this room, but even take all of us, we still don't know all the right questions. So if you can actually come in, digest all of that, and come up with better questions that will lead to better outcomes further on, we're very, very interested in what those types of questions could be if you had this type of information, and we're interested in launching challenges and working with people around that very thing of what could that mean, and could you put this large chunk of data together with other large chunks and make even a bigger difference where we can step outside. And one of the nice things since I've joined UnitedHealth Group has been their willingness to work well beyond the walls of the company with others. And sometimes it's not, you don't get all or your quote fair share of the benefit of that, but for the greater impact of the health system, they made that the leadership, at least that I work for, has made that very clear that is still something we want to pursue.
Now, I'm going to break this for a second here. If there are questions, please find our volunteers with the microphones. We definitely want this to be part of a collaborative conversation. I'm checking the ConvergeConf hashtag. If you have questions, we can pull them right from there too. So please continue to participate, and the people with the mics, just raise your hand so you can catch my attention. Oh, we have one already?
Thanks for the opportunity. So I would want to do a little bit of derivative learning, kind of root cause stuff here. At some point, someone hired you, Brandon.
Yes.
So why? At what point did the organization realize that they needed to innovate? And at what point did you sell them on the idea that you were the person to help them do that?
Oh, well, all right. Yeah, I guess I'm fortunate enough to win the Bake Off. So 3 years ago, perhaps, the company, including the CEO, decided, and it was probably leading up to healthcare reform and other things going on, and the ongoing mega trends of consumerization of health, that they didn't quite have all the answers to what was going on, and the need to actually use new methods, new tools, new ways of getting into what was going to be the future of healthcare needed to happen. UnitedHealth Group has a long history of innovation, in many great things, and lots of different acquisitions that fill in the holes of their strategy. But this was something they felt was kind of fundamentally different, and so they and this is going to sound pretty typical, right? They formed an innovation council, and this innovation there's 6 major segments in the company. Each is headed up by CEO. That's the innovation council. Those 6 plus CFO and some other folks as well. That group got together a few times. And to their credit, they say, we're not sure we know exactly how to do this. We're all incredibly intelligent, great A players, but we need some folks to come in and help us out with that. And I, frankly, was just a very fortunate winner of the bake-off of who they were looking for there. We also brought in another gentleman, a colleague of mine, who is really an expert in design thinking and human-centered design, who does have kind of half of his career is in healthcare as well. So there's an interesting and good blend. And then we have a group of innovation champions throughout the organization that we work with that bring forward both new ideas, and we're able to execute as well through them. So how I convince them, I'm not sure, besides showing up and kind of showing my background and giving them this is how Brandon would structure innovation here across the enterprise, and they bought it.
So your humility is marvelous, right? But we have to learn from that case study, right? So we talked about large organizations and innovation and how challenging it is for large organizations and innovation. But that case study, that example of the organization that chose to do it right, we need to understand that. And I think that one of the challenges with innovation is that we get these ideas and these inspirations and we go off, and sometimes they're successful, and if they're successful, we assume we were the smartest person in the room, and if they failed, we assumed we weren't. But there's something at that core that made it successful or not, and I don't think I'm hearing, maybe as a theme, I don't think I'm hearing enough about the root cause of how innovation springs forward or how it gets stopped.
So in a large enterprise, I would actually tag it much like, say, the quality movement of 30 years ago, before we knew what quality was all about, where we had to go over, where many industries had to go over to Japan and learn quality, and then it became Six Sigma, and then it became routinized, where you've got Six Sigma black belts and all kinds of other things, where you systematize it throughout an organization, and then you're able to do it all the time. Well, if innovation is kind of like quality was 30 years ago, we're still trying to get there. And so one of the ways to do it is to be able to systematize or processize the innovation throughout the organization, right? So come up with the processes. Ideas, frankly, are fairly easy to come up with. There's just, you have to find the execution engine to be able to make it happen. So the keys to success have been, a fund or a bucket of money that isn't taken with the whims of the quarterly earnings and things that happen right there, right? Some amount of dedicated resources. I don't believe in a big innovation teams that does all the innovation themselves, absolutely not. But some folks that are in charge of facilitating that and actually making that happen, a way to get outside of your own box and talk to others well outside your industry, and for that to be okay and move on, and then to even push the envelope even further, to not only be developing innovations inside your organization, but to follow the example of some of the great med device companies here and pharma companies and things, and open yourself to open innovation, even in the services and process, which is a process sector, which is a bit less mature in terms of how it does those things than we say than those there. So we can talk offline though to talk more about that case study. Appreciate it.
It sounds like innovation. People are beginning to realize that innovation is going to pay off, and then actually in the same way, I guess in the way we talk about healthcare reform or other things changing things, wellness actually was going to bring ROI. The example that you had, again, incenting people to be healthier, which is going to cut costs in the long term for big organizations. Yeah. It sounds like in some cases, many of the organizations realize, wow, we need to be more innovative, but that is not in our culture. And you talked about a systemic approach to saying, all right, we're going to foster unique ideas out of here. We're going to go in directions we weren't otherwise going.
Yeah, if you're a company like UnitedHealth Group and you're just waiting around for the next new great idea to come without anything else there, it's like any other big company that hopes on that. It may happen, but who wants to bet their future on that? Need a way to actually build that out through organization. And we're not a big R&D company. We don't have big labs and things like that, but we do have some people dedicated to doing that. We have great partnerships. We have new, everything from human resource policies now that are being changed to enable that to happen, to looking at how we actually structure different parts of the organization so that can come forward, to coming to play things like Converge or CES or places where maybe we wouldn't have been at before in order to find new ideas and foster them forward.
And speaking of big bets, I'm sure there are a lot of entrepreneurs and others in there saying, all right, how will reimbursement change, or how will how will insurance companies look at certain behaviors or opportunities? Any insight that you could give the audience here of people looking for opportunities out of UnitedHealth about how they're thinking about, certain sectors, whether it's wellness or data or mobile, and how they may look at it as a viable option for reimbursement or beyond?
Yeah, frankly, it's a tough question to answer, right? Because a lot of the reimbursement is driven off of what the codes happen to be at the time. But in moving that forward, we do have a very large health and wellness company that we sell direct to employer groups, small employers, as well as government entities. And anything an entrepreneur here could do to actually prove some of the efficacy of that and bring that forward. Very interesting, right? What we're doing with the Diabetes Health Prevention and Control Alliance, that shows that it is valid and works. It not only helps, it profits the organizations who are a part of that group, literally in terms of profit. It profits the individual in terms of their health, and it actually is a better deal for the system, where you can get all those things into alignment. Obviously, very interested. And then what I spoke of before, just the data and the understanding and the right kinds of questions. We'd be very interested in those kinds of collaborations.
At the beginning of this, you were not a healthcare guy. Well, now you're a healthcare guy. Sorry.
Yep. All of a sudden, just
boom.
now.
But if you're a health system, or you're a payer, or you're a healthcare entrepreneur, and say, gosh, I do want to think outside my box. Are there certain companies that you would say, watch how they operate? I think you can learn from them, because even so, you can't translate everything into healthcare. It's not possible, because regulations are different and all these other issues. But there probably are some more than others. Are there ones that you enjoy, that you have favorites that you think
in or out of healthcare?
Yeah.
Frankly, I enjoy looking outside of the United States. Number one, at models of both healthcare and not in other countries around the world, because they're so insightful and have such different parameters than we do around it. and the ability to port those here in a different way would be very interesting. I thought the recent book called Reverse Innovation from Vijay Govindavaran was really interesting, and some of the models that they do in India or China or whatnot that can now work in the United States, kind of reversing that. Instead of a rich country, scaling it down for a poor country, it's the opposite. But given my background, I do think there's some very interesting retail and consumer product companies that have been doing this a long time and doing it very well, and their ability to innovate very, very quickly. I mean, I even see, Walmart, Procter & Gamble, et cetera, who are just really interesting in the ways they go about it and how quick they innovate on their operating model and they innovate on their products and services.